patient chart. So I got jack-o'-lantern, he's 25-year-old male, status, post-op appendectomy. I'm gonna grab another pillow too. So the status post-appendectomy, physician's orders, I've got to send a spirometer every hour, 12 breaths while awake, acapella every 4 hours while awake. Maintain stats greater than 92%.
Hello.
Hey, how you doing?
Good, how are you?
Good, I'm Marnie, I'm with Respiratory. I'm just coming in to check you out, and I'm gonna do, teach you how to use some devices to help you cough and help you take deep breaths. How's that sound?
Sounds good.
Okay, before I get started, let me get your name and date of birth.
Jack-o'-lantern, 06/04/2001.
All right, I'm gonna verify that. You can do that with your bracelet, or you can look at the computer. So how you feeling today?
I'm good, a little sore.
A little sore, where are you sore?
In my stomach. Had appendectomy, so.
Are you in any pain right now?
Not currently.
No? Okay. When was the last time you had pain medicine?
3 hours ago.
3 hours ago. Okay. Does it hurt when you cough?
Some.
Okay.
Yeah.
All right. So the first thing I'm gonna do is I'm gonna check some vitals. I'm gonna check your oxygen. Is that okay?
All
It's
right.
on your finger. Turn it on. What's my oxygen?
93. 93. That's what I was thinking.
What's my heart rate?
98.
Okay. What's my respiratory rate?
12.
12. What's my color?
Perfuse.
Pink. Pink? Good.
Light.
I'm gonna listen to your lungs. Is that okay?
Sounds good.
I'd listen to the back. What are my breath sounds? What would I expect to hear? Maybe with somebody with an appendectomy who's just post-op.
Diminish
Diminish where in particular?
on the right side, the right lung.
So
Yeah,
think,
on the
So
outside.
think where the base is. Very good. So think I would expect to hear some atelectasis in the bases because it's the most distant part of the lung to get ventilation, right? Your perfusion is highest in your bases, but your ventilation is lowest in your bases. Apices are always the highest ventilation, lowest perfusion, right? Okay. At least in an upright position. All right. So, okay, I got all that. So we're diminishing our bases. Okay. So how tall are you?
6'4".
6'4", so I get a male here. 6'4", that's 72, 76 inches. Ooh, you tall one. Right on here. Okay, we're 23. So I got 20 and 25. We'll do 3,900. Somebody take 3,900 times 0.80 for me.
3120.
3120. This one only goes up to 2,500, so I'm just gonna max that out there. What did I do with my little mouthpiece?
Oh, there's one right here.
Pretend I'm still in the room. Alright, so you got it for a shuttle box. Yep. Otherwise you don't know how to set it. Yep. Alright, so what I'm gonna do with you is I am also gonna, have you been coughing up anything?
No.
No? Okay, well we're gonna work on that as well. So the first thing that we're gonna do is something called an incentive spirometer. Have you ever used one of these before?
I have not.
Okay. What this does is basically gives me and you a number of volume, and that basically tells us how well you're doing at taking deep breaths, okay? So your goal, we're gonna say here, is 2,500. It's actually higher than that, but that's the maximum that you can get. And what I want you to do is try and get to that goal. The first thing I'm gonna do though, is I'm gonna have you splint, because your abdomen's gonna be sore and you're probably gonna cough. So what I want you to do is hug this tightly for me. And if you feel the urge to cough, I want you to push in for me, okay? All right, so what I want you to do is I want you to take a slow, steady, deep breath. I want you to keep this little blue peg in between these two arrows. I want you to hold your breath at the end for about 5 to 10 seconds, and then I want you to exhale. We're gonna do 12 of these. You ready? Blow all your air out. Lips nice and tight. Slow, steady breathe that breath in. Okay, keep that peg here. Good. Go, 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 go. Keep going, keep going, keep going, keep going. Okay. Hold your breath. And exhale. Okay, and do it again. We're gonna do it 12 times. So he's done it 12 times. What did he get?
3,000.
3,000. Okay, so he's doing okay. Actually, I want you to give me a number that's less.
2,000.
2,000, okay. So I'm doing a few of these just to kind of gauge where we're at. Now we're gonna do this device, okay? And this is called an acapella, and I'm gonna start somewhere in the middle here. And what this is gonna do is you're gonna take a nice deep breath in, and you're gonna blow into the device, slow and steady. I want you to keep your cheeks really tight, okay? So it's gonna be like this. Okay? And we're gonna do this 10 times. We'll do it 10 to 20 times, we'll see how you do, okay? All right, you ready? Deep breath in. Blow, 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 good, 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 good. Okay, so about 3 to 5 second exhalation. All right, and we're gonna do this 10 times. 3, 4, 5, 6, 7, 8, 9, 10. All right, I want you to go ahead and hug yourself. Take a deep breath in and cough for me. Anything come up?
A little bit.
I heard a little bit. Go ahead and spit that out for me into this cup. What color do I have?
Light green.
Oh, that's not good after an appendectomy. Got an infection. How much? Dime, nickel, quarter, half dollar?
Penny.
Oh, a penny. Okay, so a little bit there. Is it thick, thin?
It's thin.
Oh, so it's easy to cough up. Good. Does it taste bad?
No.
No. Okay, that's good. So we're gonna go ahead and we're gonna do 10 more. So we're gonna do this 4 to 6 times until we clear all the mucus out of your chest. Okay. Okay. And ding, 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 ding. Okay, so until we finish. All right.
And cough again.
You cough after either you do it until the patient coughs, right? So if they cough between the 10 and 20, let them cough. If not, have them cough after each cycle.
Okay.
Okay.
When do you stop?
After you've done 4 to 6 cycles,
Okay.
or they've cleared. So if you have somebody who has a lot of mucus, like somebody with cystic fibrosis, if I listen to them and I hear bronchi especially, and I continue to hear it, I'll work with them until I get them clear. So this is just a guide. Remember, like if this guy he doesn't have any after a few cycles, I mean, why wear him out? But we're also doing lung expansion. It's not just secretion clearance. So that's why you want to make sure you do the 4 to 6 cycles, okay? Because it's not just secretion clearance. So he doesn't have any more secretions, but we still want to expand his lungs. So we want to complete that minimum of 4 to 6 cycles. If it takes you longer to clear someone's mucus, then do it longer, right? Get all that stuff out of there. All right, that's the being a respiratory therapist part, and actually critically thinking about what you're doing. This is just a guide, the 4 to 6 cycles. So 10 to 20 breaths, 4 to 6 cycles, and if you clear all the mucus out in a couple of cycles, then just do it for lung expansion after that. Okay, so now that we're done with that, I'm gonna have you do this again, and we're gonna see if we can get any better numbers. Okay, so we got 2,000 initially. Blow all your air out. Lips nice and tight, slow, deep breath, go, 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 good job, good job, good job, good job, good job, great job. What do we got?
2,900.
Okay, right, so what we're looking for is to see that we've actually done something with the patient. So in this case, doing the IS before and after is a great idea. So you can see if the therapy that actually did lung expansion and secretion clearance actually worked, okay? If you're just doing this by itself, you just have to do the instruct, right? Okay. So we did that 12 times, and we got consistently 2,900. Okay, so one more time, I'm gonna have you splint, I'm gonna have you take a deep breath in and cough. Anything come up?
Nope.
No, nice and dry. Okay, so if it's okay with you, I'm gonna check your vitals again, is that all right?
That's good.
Okay. All right, so what's my oxygen saturation now?
98.
Good. So is it also an indicator that you recruited more lung? Yes. So if you deliver, if the patient's on room air and I give them 8 liters of oxygen during EasyPAP and they go up to 100%, it's because they were on oxygen, right? But if I'm on room air, we do the devices and now his sats have improved, I've recruited more lung. Okay, so that's a good sign, right? What about my heart rate?
Anybody else want to talk? 70.
Sure, okay, so that'll be fine. Color?
Open fuse.
Respiratory rate.
12, 14.
Sure.
Either.
Is it okay if I listen to your own?
Meet in the middle.
Is it okay if I listen to your own?
Yes.
Sit him off, listen to his back. How do I sound now? What would I wanna hear now? So more air movement. I would wanna hear some air movement now in those bases. So that's my goal, right? So if now I have improved oxygenation via the SAT, and I can now hear more airflow in the patient's bases. Okay, so we've done something. Okay, we got some mucus out, right? All right, so now I'm going to let the patient know, hey, I'm gonna put these devices at the bedside for you. And what I want you to do is I want you to pick this up in between commercials, and I want you to do a few breaths. So you wanna do 12 breaths an hour, 12 breaths an hour while awake. Don't set the alarm and do this during the night, okay? We want you to rest. Got it?
Got it.
Okay, and if you feel like you have the urge to cough or you're having a hard time coughing stuff out, go ahead and pick this guy up too and do 10 to 20 until you are able to clear that mucus that's in your chest, okay? But you really wanna work on this goal. And I also want you to get out of bed if the nurse will let you. Sound fair?
Sounds cool.
Okay. Is there anything else I can do for you before I leave? Don't forget to splint. All right. All right, well, I'm gonna head out and I will be back to check on you in 4 hours. Yeah.
What does it mean when you to splint the patient?
So you're splinting for pain. Let me foam out and document. Okay. All right, so now let's talk about that. So he just had abdominal surgery. I want you to take a deep breath in and cough. Put your hands right here where his appendix would be. Okay, now take a deep breath in and cough. What happens to your abdomen?
It's contracted.
It pushes out, correct?
Yeah.
When you cough, everybody do that. Where's your appendix? It would be down here. Take a deep breath in and cough. It's gonna pop out, right? So you have sutures down there. You just had this guy taken out. As that pressure pushes, your diaphragm descends and it pushes your abdomen out and you cough with pressure. What does that do to this spot? It puts pressure on this spot, doesn't it? It pushes it outward and that causes a lot of pain. And a lot of patients will, right when they cough, or my chest hurts when they cough. So if they've had surgery splinting it, but now take your hands and push real tight with a splint, using a splint, take a deep breath in and cough. You see you're preventing this wall from expanding outward, so it's less pressure applied forcefully out. So you're actually holding the sutures and everything in place. So it helps with pain. Note, I asked him if he was in pain, right? I asked him if he's been having pain with coughing, because if he's in pain right now, I'm gonna make him in more pain with coughing. So maybe we wanna also ask the nurse for some pain medicine to get that on board, because I'm gonna be exercising him and it's gonna hurt. Okay, so anytime you have somebody post-op and you have to work with coughing and deep breathing and things like that, always offer them a splint. Yeah.
So we want them to cough, right?
We do, we want them to cough, yeah.
So wouldn't most pain medications be contraindicated for cough suppression?
Not necessarily.
Okay.
Not necessarily. Ibuprofen wouldn't, Tylenol wouldn't.
Oh, like
right,
those.
narcotics
Yeah.
could suppress your breathing and your cough reflex, and you can't poop. Well, there's a lot of things that go along with narcotics, but if you take Tylenol and ibuprofen together, they're actually a very effective pain control.
I think you're talking about the heavy hitters.
Yeah. So, it kind of depends on what's going on. And if they're on narcotics, it's even more important that they take deep breaths and cough, right? Because again, you have a tendency to suppress your respiratory drive with narcotics. You're not gonna take a deep enough breath. You're gonna be tired. This is why this is so important, especially post-op, okay? But it's not contraindicated because of that. It's actually an indication even more so with narcotics than without narcotics. But you're not always on narcotics. There's other things that they can give as well. And it kind of depends on what your tolerance to the meds are too, right? Any other questions?
So for a splint, you're just having the patient hold the pillow.
Hold the pillow.
On top.
You ever notice, and ever see open heart patients, they give them a heart pillow? They do, they give them a heart-shaped pillow, it's red, and they can put it on their chest if they have to cough and take deep breaths to split pain.
I thought it was like a gift just for them.
That's specifically to hold over the wound, because breathing hurts.
It is cute though.
Yeah, it is cute though, yeah.
Are you gonna keep the diagnosis the same, or is it gonna be like?
It could change.
Yeah, where does it say, like, so if I came here and read it, I just wanna not be confused, like, where there's no 4 to 6 cycles up there, so I wouldn't.
It's on your competency. That's, you should know how to use the device.
Oh, well, I'm.
That's your job.
Shoot, man, I'm just trying to lock in right there.
This is the order.
So that's gonna be based
You
on
need
the-
to know how to use all of these devices.
Oh,
Yeah,
yeah,
this is
okay.
your education,
And you could just
Right.
pick whatever one that is, and it's 4 to 6 cycles for any one of them?
any one of them.
Okay.
Yeah.
Okay, I have another question. So what if like you write a diagnosis on the board that I'm sort of not familiar with?
Oh, just ask. Marnie, what the hell is that?
Okay.
Cystic fibrosis, that's a genetic disease that affects secretions in the body. Anything that, any area of the body that produces secretions is affected. Men are typically sterile because the vas deferens gets clogged. You have issues with blood sugar, anything that secretions, your guts don't work properly, your lungs get full of mucus. He's over there, ooh, I don't know about this one, right? It's primarily Caucasians. If you have Caucasian blood, you could get it, right? Which disease is more prone to African Americans? Anybody know?
Sickle cell.
Sickle cell, right? Where it's just not, that's a disease that affects certain races, right? Cystic fibrosis is primarily a Caucasian disease, unless of course you're mixed, you can have cystic fibrosis. If you're mixed, you can have sickle cell, right? But it's very, very specific. Okay, and that's a lot of secretions that they produce because of that. Okay, so it depends on the disease, just ask me. What about this disease causes them to have either mucus production or need lung expansion? And here's the thing, when you're looking at lung expansion, can it help secretion clearance? Yeah. So if we're talking about the airways, if I take a deep breath in, I get air around that. I'm trying to get air around that mucus, right? And if I get air around that mucus, that's more force I can apply to that secretion, okay, and help move it out. So I want to recruit my alveoli, right? I want to stabilize them, but I also can help with secretion clearance that way. Same thing with bronchodilators, it's for bronchoconstriction, but if I maximally dilate the airways, might it be easier for mucus to come out if it's got a bigger pathway? So there's all kinds of side effects, right, of the treatments. There's primary reasons why we use it, and then there can be secondary effects because of it. So technically, you can call all of these secretion clearance devices, but their primary is, what's this one? Its primary use is lung expansion, right? This guy's use is both lung expansion and secretion clearance, but they can augment each other, okay? Okay, any other questions? Want me to demonstrate something else? What would you like me to demonstrate?